South Africa has some of the worst cases of gender-based violence against women and children in the world. Many women and girls are murdered at the hands of their partners.
So sad that South Africa is the rape capital of the world.
More than 13,000 were domestic violence related.
In South Africa, we do find that every 3 hours a woman is killed.
Almost 73,000 assault cases reported in the same period.
Feels like we're not safe anywhere. As long as you're a woman in South Africa, you have a target on you.
Like millions of men across this country, I am appalled at the war that is being waged on our sisters, our mothers, our wives, our partners, and our daughters. Violence against women has become more than a national crisis. It is a crime against our common humanity.
On the 1st and 2nd of November 2018, South Africa's women said enough is enough. During that first South African presidential summit on gender-based violence and femicide in Pretoria, they made it clear that South Africans can no longer look the other way. We need to acknowledge that we have a big problem. Gender-based violence is an epidemic and a national crisis.
And the case went cold.
South Africa continues to be among the most violent countries in the world, with a femicide rate which is almost 5 times the global average. 1 in 3 women in South Africa is a victim of domestic violence. Every 8 hours, a woman is killed by her intimate partner. The statistics paint the gruesome face of GBVF in South Africa, more so for the victims who share a home with their perpetrator. And so amidst the COVID-19 pandemic, the mammoth task of creating a South Africa free from gender-based violence and femicide was undertaken. COVID-19 presented additional challenges, and the rate of gender-based violence in the country increased significantly during this period. President Cyril Ramaphosa then declared gender-based violence as South Africa's second pandemic. The National Strategic Plan's vision is a South Africa free from gender-based violence directed at women, children, and LGBTQIA+ persons. To achieve this, 6 pillars were identified, with the Department of Social Development leading the 4th pillar of the National Strategic Plan. Pillar 4 addresses gender-based violence and femicide through a focused approach on response, care, support, and healing. In line with this year's presidential GBVF summit, the Department of Social Development, under the theme Accountability, Acceleration and Amplification Now, reports on the implementation of the previous 3 years.
What I think is very important for a start is to indicate that all government departments were requested to make sure that they have plans for the implementation of the National Strategic Plan for a fight against gender-based violence. We have, as a matter of fact, as a department, been implementing Pillar 4 of that strategy in ensuring that the services get closer to the people, but with a greater focus on supporting victims of gender-based violence. It's about supporting, and it's also about empowering victims. But the department is also responsible for legislation and policies around the issues of gender-based violence and the support for women in general.
The Department of Social Development is the custodian of the Children's Act, which obligates us to care for and protect children. They are the most vulnerable to sexual violence and killings. Since the summit, there's been great achievement around ensuring children are cared for and protected. More than 13 million children receive the Child Support Grant, which is collected by their caregivers, in the majority women. Over the past 3 years, we have had programs specifically for children in order for them to be aware of their rights, for communities to protect and care for children, and for them to understand that the caring and protection of children is not just for government responsibility, but society as a whole.
leadership. It forms part of our compendium of care, which is our behavioral change programs. Amongst it, we've got Men and Boys Championing Change, where we're hoping to actually have a different men by 2030, but also affirming the ones that are there to assist us to reduce the high prevalence of gender-based violence, of HIV, but also taking responsibility for their children. We also have the program called YOLO, where you are saying you only live once, behave responsibly and take responsibility for your behavior. And this is a program that focuses on 15 to 24-year-olds, because it is that time when, as a person, you're actually not sure whether you are still a child or you are an adult. Then we've got Chomi, which is our 10 to 14-year-olds, where we're trying to make sure that we catch our children. We teach them through play. They need to play whatever the indigenous games of that area, from hopscotch to khati, diketo, ligusha, snakes and ladders, you name it.
Children really indicated gaps in our child protection system. And one of the things that they were saying that we are not doing right as government and other stakeholders within the child protection system is that we are inadequately providing resources which should assist the country in curbing violence against women and children. One of the gaps that we also identified as the department when we were reflecting on how much progress are we making in terms of addressing the issues of children, and we realize that as much as we've got our Child Protection Week, we are not doing enough, because we cannot highlight the plight of children within a week.
We are here as the children of South Africa to come and advocate for the rights of other South African children. Therefore, we would like to put forward a request that every time we have a parliamentary sitting, each and every minister has to be present here, because we are talking about issues that touch on different ministries, meaning that it touches on it also touches on the police as well. It also touches on public works, as well as finance as well. So we request that we request their presence, just like we requested the presence of Honorable Minister Lindiwe Zulu. We request their presence here, because we are talking about burning issues. Umamu Enji has to be here, because we are talking about education now. We don't have anyone who we could hold accountable and say that, Mama, when we presented, you were here. This is what we said. Thank you very much.
That's when we started to embark on having a 365 days child protection campaign with the purpose of mobilizing parents, caregivers, communities, stakeholders, including families, to care and protect children.
For children who may be living and working in the streets, support services are also extended to shelters all over the country.
We are a united family, and through this unity, I learned to be a responsible individual from the teachings I received from our elders and the peers at the home. As a youngster, I learned to love, to be responsible, and to respect the people around me. Oh, how good it feels to be loved and groomed, to be a better person, and to protect those around me. Thank you. Thank you.
For the parents that come with children, we've got a creche that is run in-house. We also have social workers at Lifeline that help put the kids through school. They find schooling for the children. We've got 2 drivers that assist with transporting those kids back and forth from school.
So when we talk about gender-based violence, we have to be conscious of the fact that children are often involved. And we are, as a department, currently working on the Children's Amendment Bill, which essentially is trying to strengthen areas around the care and protection of children. And I think this is one of the mechanisms that we will be utilizing as government, as the Department of Social Development, to ensure that we protect not only women but also children. And I think that that's an important aspect. In addition, we now have the social assistance Amendment Act, and what we've recently put out in terms of regulations is additional support to children who are or families who are double orphaned, who have double orphaned children, and they are now able to access additional funding from the grant system to be able to take care of the additional children that they may have in the households.
Our section 27(1)(c) of the Constitution is very clear to say everyone has got the right to access social security and social assistance, including if they're unable to take care of themselves. So we, as a department, in the past 3 or 4 years or so, we have done quite a lot in terms of that is concerned. We have done programs such as maternal support, which is a policy that is looking at providing income support to vulnerable pregnant women.
In the country, the face of poverty is black and female. The Department of Social Development recognizes the linkages between a lack of economic opportunities and gender-based violence. Women sometimes feel trapped in abusive relationships due to their dependency on their abusers. This is why giving cash to women to look after their children through the Child Support Grant and the 350 COVID-19 SRD grant remains one of the most important child protection tool measures. The grants empower women to provide for their children and gives them the freedom to make choices about their families and their bodies. The Department of Social Development also makes provision for women to leave their homes and seek refuge or safe space, and at times with their children. There are currently 300 shelters across the country which provide psychosocial services and skills development, emergency white doors and green doors, victim-friendly rooms located in numerous police stations across the country are also available to victims. Digitization is in effect as we keep digital records of our clients for Femicide Watch. But, of course, before any assistance can be given to victims, someone needs to speak out. The GBV Command Center was established in 2013 to respond to gender-based violence and femicide. It has won international awards as one of the best facilities worldwide. A number of factors make the center unique. 1. It is manned by qualified social workers. 2. Victims do not need to disclose where they are. We use geolocation to find victims wherever they may be. 3. Victims can be linked to other key government services, for example, health professionals or SAPs. 4. Persons who are hard of hearing can also call into the center and be assisted via Skype in sign language.
In the past 3 years, the Command Center has achieved quite a lot, in a sense that the Command Center used to be in a private owned facility, which was a rental facility, and we've achieved through our partnership with the Department of Public Works and Infrastructure to move the facility into a government-owned infrastructure, which was really an achievement, in a sense that there's a lot of savings that is in that.
In that moment, if it is an emergency call, the victim's life might be in danger, they might be in a physical abuse situation, in a trafficking situation, so we immediately link them with SAPs within their area. Okay, so in if it's a non-emergency call, the social workers immediately provide psychosocial services and support telephonically.
After 7 days of referring the case to the stakeholders, we make a follow-up to check or find out the progress on the cases that has been referred. In most cases, with regards to gender-based violence and femicide, you find out that the cases are emergency-based. The other thing that has worked very well for us is the fact that the Command Center formed part of the essential services during the COVID-19 pandemic. So we were here all the time, 24/7, and the services were easily accessible via a toll-free number to victims of gender-based violence. And they will access the services from landlines, from cell phones, and it's free. any time of the day, you could just call it a toll-free number and you'd access a social worker.
The National Emergency Response Team, since its inception in 2016, and when it was launched by the Deputy Minister of Social Development, Honorable Edieta Bogopane Zulu, it have really strengthened a good relationship with the National Department of Social Development and also the provincial, district and the local Department of Social Development at all spheres of government. As part of that, the National Emergency Response Team have developed a standing operating procedure that would dictate in terms of how cases would be handled when any of these cases are either being reported straight to the National Emergency Response Team or either through the Gender-Based Violence Command Center.
As NART, we are also involved with the Department of Social Development, more specifically the Older Persons Program, where we work closely in bringing awareness to communities, especially rural communities, on the need of the older persons, especially older women, that the community members sometimes seen as witches and witchcraft and kill these vulnerable women.
So as it relates to legislation, we are currently working on the Older Persons Amendment Bill, which is currently before Parliament. And really what we seek to do is to try and strengthen our measures or mechanisms rather as it relates to the care and protection against abuse of our elderly.
So Access Chapter 2 is a human rights organization focusing on the rights of LGBTI people, women and girls in all their diversity. We work in 7 provinces, Gauteng, Northwest, Limpopo, Mpumalanga, Free State, as well as Eastern Cape, and these provinces, we have predominantly kept consistent with our advocacy work, with sensitization and our other strategic area. One, we have direct services where we provide competent service from health to legal to psychosocial support and community development programs, including research. And part of this is setting up what we call We Belong centers. And then also just to indicate that we provide all our services free to communities, young people, LGBTI people, and women and girls. And that's what we've been servicing over the last few years. We're still above 50% of negative attitude towards LGBTI people. We still have 88% of LGBTI people who do not report a violation against them because of being outed and secondary victimization at service points.
Okay, VFR, it is a victim-friendly room where we provide psychosocial support services to the clients of violence and crime, inclusive of gender-based violence, domestic violence, femicide, and human rights violation. VFR, it was established in the police station with an aim of allowing the clients to access a range of services such as psychosocial support services.
The shelter was established in 2003. Then we got our first funding in 2004 from the Department of Social Development. DSD is our main funder. It's really our biggest funder for all the services that we render. The shelter accommodates beneficiaries of gender-based violence, mother and her children. We also accommodate trafficking in persons. So we ensure that the beneficiary is assisted holistically, from physically, emotionally, financially, yes, through the skills development that we engage with them. And as well as they are here, they also become part and parcel of some of the things like cleaning offices, car wash, and in the skills that they do, they also get some money as people visit or we sell. So you find that we would love other departments to come on board. Department of Housing, Department of Entrepreneurship, where skills can be, it's something that they really can take home handy so that they are economically empowered and can manage to stand on themselves as an individual.
My ex-husband, he killed my son. My son was 16 years. They fought. I don't know what happened. I was not there. So Mabalwa, my ex, unfaunela, I was next door. Mangijima ngizendlini. Ngithola umntwana wami uphansi. Ukuthi bese ningasenandawo yokuhlala. Singenandawo yokuhlala, sihambe sihlala ezitradweni, sihambe sihlala phandle, sihambe sihlala emizini. So omnye usisi osebenza social development wanfonela icase yami bekayizwe ngomnye usisi we-gender-based violence waselokishini. So wathi-ke na-ke manje izela. But lana ngithole ama-social workers bakhuluma nami, bangikhansela, ndihamba counselling, banditransferela kuma-psychologist la eduze. And nomntana wami-ke wambithelile clinic, so naye bayamsiza kakhulu.
I used to stay in Yeoville, Hunter Street. So my next door, I had a house next to a block of flats. In this block of flats, every wee hours of the morning, there'll be children crying, there will be screams and all that. She was then 13 years old. She was 13 years old. That's what made me very angry, because the child was young to be doing sex work and to be in the street at those hours of the night. Why did you come to Johannesburg? And the other one, two were from Eastern Cape and one from KwaZulu-Natal. I said, but I don't understand you guys. If you guys don't want to do the job for these people, you can come into my house. This is my gate. Don't sell your body, because it's like you are punishing yourself more than your uncle did to you. Or you are punishing yourself more than your pimps. You know, I was just preaching that gospel to them. So I decided, no, let me see where I can get a place to stay. Mr. Mayor Amos Masondo gave me the keys. Here now I've got 16 girls that are here. And I've got 4 boys on that 16 who are also commercial sex workers. Because when you are here, I don't allow you to still go and do the sex work.
Originally, I'm from Zimbabwe. As soon as I finished my high school, I'm 34. The time I left high school back at home, I had plans to change my life for greener pastures, so I came here to South Africa. Unfortunately, things didn't go well for me. When I arrived, I tried to look for a job, but things didn't turn out well for me. So I ended up being in the streets, tried to look for a job at different places, but nothing was coming up. So along the way, I met some other friends. Then they introduced me to the streets, whereby they go and sell themselves. Then I decided, yes, that's what I wanted to do. I started going to the streets, just like I'm a gay man. So I met this other guy who introduced me into drugs. That time I was taking drugs, alcohol, and my life was just spiraling out of control. I came here, I met Mom Barbara. Then she gave me a place to stay. And then I started learning skills in baking, sewing, and doing other things like making bags, handcraft. I thank God I've got experience.
Of course, while we might decry the period with which the women live in those shelters, we would like those women to leave the shelters feeling much more empowered and feeling more safer. Unfortunately for us, for now, there's a time period under which these women and children have to be in these centers.
And we also do house persons with disabilities. But with that as well, we still need to focus on more education. For example, we have one member of the deaf community here, but the challenge is the person our staff is not well equipped, is not trained. So we're seeing an opportunity for more trainings that need to happen for the staff that is hired to work in shelters on how best to accommodate the different kinds of disabilities that exist.
Of course, you know that we are responsible for the Victim Support Services Bill, which really aims at putting the victim at the center of the criminal justice system and making sure that they have adequate legal representation. But more importantly, we want the justice system to take into cognizance the voices
While
of
perpetrators of gender-based violence are often men, men too are victims. As such, the Department of Social Development extends most services and shelters to men who are victims of gender-based violence.
We know that gender-based violence towards women is a big issue in South Africa, but I don't think it means we should ignore men.
So the relationship that we have with the Department of Social Development is that for the longest time I have been working in the sector, in the NGO sector, trying to deal with issues of sexual and gender-based violence. And we've now have a relationship with the Old Mutual Foundation. And for me, I think it's such an exciting relationship because you've got the public sector, you've got an entrepreneur, and you've got private sector. So just that combination means that we are really forging together in ensuring that we address issues of SGBV. So I'm really excited about the work that we have been doing at Lusikisiki. As you would know that in 2020, the police crime stats indicated that it was the one with the highest levels of SGBV in the country. And I think that was quite worrying for the sector, but also for government. I know DSD is joining us, so we're really just excited. And the other wonderful thing about it is that we're also including traditional leaders. We've really ignored the role of traditional leaders in being able to work with us in addressing SGBV, especially bringing men in ensuring that we are creating a change.
We also work a lot with traditional leadership so that, as you know, that if you go to the rural areas, the traditional house is the most important structure where communities go to.
We are a body or movement or structure started by men who are activists in the space of gender-based violence and femicide. And for us, it was a call to rally all the men in the country, from politicians to personalities, sportsmen, and we were affected by the scourge or the level how GBVF has affected our communities.
Yes, the National Development Agency, how it fits into the program of gender-based violence is that the NDA gives funds to NPOs who are responsible for running special programs that are focused on gender-based violence. The National Development Agency also receives funding from the Department of Justice through CARA funds, which is Crime Asset and Recovery. Monies that have been collected from criminals, and that money has to be used for the good of our communities.
So for us, as NDA, it was 95 million. And we then sat and had a discussion, and ultimately, we then felt that we would then rather give an amount, which was 300,000, to those organizations that we felt at least they would be in a position to handle the funding correctly. And then we had 200,000 to the ones that we refer to as emerging. The purpose actually being that if you fund those that are emerging and you can build their capacity through mentorship and coaching, they would find it easier to access funding from any other businesses or any other organizations
besides the National Development Agency.
What we also do is that we have what we call as dialogues in the department. Those dialogues form part of the communication about policy, about what people are and how people are receiving policy, and where we can be able to make changes. But what we have done also last year in terms of gender-based violence is to have community radio weekly programs where we speak to different radio stations and actually also in their languages. Most importantly is that we speak to people in the language that they understand and within their community experience and their own ways, because most of the time as well, when we do policy and when we speak to people, we speak in English. But when we go to communities, we are able to see whether the policy is also received in the ways of the people and the way they understand things. I always make the example when we went to Lusikisiki and we're talking about reporting violence against children. But we find that in that community, when you're talking about reporting a pregnancy in particular, families speak to each other. The girl's family goes to report to the boy's family, and it becomes a family issue. You find that then the reporting doesn't happen, because in that community, when a girl has been impregnated, whether by an older person or the same age, the reporting that happens is between families. And those are the things that we want to teach communities, that when we speak reporting in English, we speak reporting to authorities so that we can be able to deal with the issues of gender-based violence and the exploitation of children.
So we push that narrative. We try to change the mentality. We try to correct the societal ills that are affecting our communities. GBV has gotten to a point where it affects everyone. It affects families, it affects children, it affects relationships, it affects even the elderly.
Over the past 3 years, the Department of Social Development has embarked on many more initiatives which directly address the National Strategic Plan on Gender-Based Violence and Femicide. While 3 years may not be nearly enough time to realize the envisaged impact, continuous and incremental progress will see the DSD edge closer to the 10-year outcome. COVID-19 has also taught us the importance of moving from paper to digital platforms. Through the integrated justice system, the Department of Social Development is digitizing its work to monitor and evaluate services, for people to apply and pay NPOs on time, building databases for older persons who are victims of abuse, and improving the Child Protection Register. The Department of Social Development continues to collaborate and partner with other departments, the private sector, civil society organizations, and NPOs. Through a focused approach on accountability, acceleration, and amplification in the implementation of the National Strategic Plan, we will edge closer to realizing human dignity, healing, safety, freedom, and equality in our lifetime.